So let's proceed on the selected, musculoskeletal conditions. On the selected musculoskeletal conditions, of course, we'll be talking in here your concerns in rheumatoid arthritis, the osteoarthritis, the gout that we have. You have fractures also as common conditions or accidents that your client used to experience. So, on the selected musculoskeletal condition, it is the rare older individual who does not experience some degree of discomfort, disability, or deformity from musculoskeletal disorders. In fact, musculoskeletal diseases are the leading cause of functional impairment in older adults. And remember, during our previous discussion that this, functional impairment or inability to maintain physical mobility of this particular patient, predispose our client to experience, of course, some, detrimental or untoward or dangerous effect on the physiologic as well as on the psychological aspect of a person. Because activity and mobility are vital to the total health of older adults, musculoskeletal problems that limit functional capacity can have devastating effects. Assessment for musculoskeletal problems should consider not only the presence of this condition but also the effect they have on an older adult's function. So prevention of these problems and aggressive intervention to minimize their impact if they are present should be an integral part of our gerontological nursing care. So we have different nursing diagnoses that can be formulated, related to musculoskeletal problems. And of course, in the presentation, in the PowerPoint presentation, you will observe also the possible causes or contributing factors for your patient to experience this particular problem. So one, of course, is your activity and tolerance that can be brought about by your muscle fatigue, your pain, as well as your deformity. It can be also your anxiety. So as you can see, if you are going to read the PowerPoint presentation talking about the different nursing diagnoses related to musculoskeletal problems, these are all related to immobility. These are all related to immobility. For example, this pain, spasm, and the cramps that we have, and the change in the body structures and functions, can lead to possible. Because of pain, the patient will experience disturbed sleep patterns. So what do we expect? Kung hindi nakakatulog maigi yung patients natin because of the severe pain or the spasm or the cramps experience, because on the problem talking about the musculoskeletal aspect. So once there is immobility, there is pain, there is disfigurement, the patient basically will have social isolation. It may affect, of course, the interaction of this particular patient or client natin to socialize, and basically it may affect the emotional aspect of a person. Another one you can have also, you can have this fracture, contracture, spasms, as well as arthritis that can give us a diagnosis. It can be acute or chronic pain natin. So these are the nursing diagnosis, and of course with our thorough assessment and determining the possible contributing factors, we can address the problem of your client. To continue with our discussion, one of the most common musculoskeletal condition is your fractures. So trauma, the cancer metastasis to the bone, osteoporosis, and other skeletal diseases contribute to the fractures in older person. So trauma, we're talking about accident, falls that we have, as well as this cancer metastasis can predispose your patient to experience fracture. And the neck of the femur is the common site of fractures among older people, and especially in older women. And most of these fractures result from falls that we have. So Colles fracture or break at the distal radius is one of the most frequent upper extremity fractures and often occurs when attempting to stop a fall with an outstretched hand that we have. So older adults are also at risk for compression fractures of the vertebrae resulting from falls or lifting heavy objects. And the more brittle bones of older person not only fracture more easily but also heal at a slower rate than in younger person. That's the dilemma. Aside from the risk of having this fracture, the healing process of an older person is usually slow compared to a younger individual that predispose our patient to experience more complication associated with your immobility. So knowing the risk of fracture and its multiple complication, it's high among older adults, the gerontological nurse must aim towards prevention. And that is one, of course, of the most important. We prevent of having this injury. Okay, drawing on the effectiveness of a basic common sense measures that we have. Because their coordination and equilibrium, talking about an older adult, should be advised to avoid risky activities. So ano yung mga risky activities that we must advise to our patients to avoid, so such as the climbing of the ladders or chairs on reach high places that we have. And another one, to prevent this dizziness as well as falls resulting from a postural hypotension. Postural hypotension, as we define, this is the decrease in the blood pressure brought about by the sudden change of your position. So our role basically is to advise the patients not to change position abruptly. Okay, what happened with with your postural hypotension? The patient usually experience decrease in that blood pressure, leading to decreased blood supply in the vital organs that can lead to possible loss of consciousness to your patient. So safe, proper fitting shoes also, with low broad heel that we have, the use of stiletto or mga high-heeled shoes natin is usually contraindicated for an older patients natin. In order for them to provide, balance as well as support. So in our figure 23.24-4, this is the correct method for stepping, to or from a curve, is to place both feet, near the edge of the curve before stepping up or down natin. So as you can see also for figure or the figure letter B, so it's the incorrect, position for an older client that we have. So, an older eyes are more sensitive to glare. So, sunglasses may be helpful for improving vision outdoors for this patient. Kasi nga, kung hindi sila, magkakaroon ng problem talking about this vision outdoors. So, there is a possibility na madapa yung client natin or talking about some other accident also. So, your general observations talking about the musculoskeletal system can begin even before the formal examination by noting the, talking about the patient's action, such as the transfer activities of your patient, the ambulation of your patient, and the use of hands of your patient. And we need to note also, observations regarding the following. So talking about the abnormal gait of your patient. So talking about the abnormal gait of your patient. So you have also, abnormality of the structure of your patient. Abnormality on the structure of your patient. You are going to check, of course, dysfunction of the limb. Dysfunction of the limb. You have also favoring of one side. You have also you need to observe also the tremors, the paralysis, the weakness, the atrophy of the limb, the redness and the swelling of the joints, the use of cane and walker or the wheelchair of your patient. And we have associated disorder talking about gait disturbances experienced by your older patient. So for gait disturbances on the gait pattern, you can have your ataxic. This is brought about or associated by the cerebellum disease intoxication. Cerebellum disease intoxication. So talking about ataxic that we have, as part of the gait disturbance natin. So this is your cerebellum, cerebellum disease intoxication. Cerebellum disease intoxication. Another one, if you observe, of course, your, the scissors. Scissors, this is slow, short steps, leg cross while stepping. So these are associated disorder. We might suspect talking about the cerebral palsy, your dementia, as well as your spastic paraplegia. Okay, another one you have also, this is spastic, these are uncoordinated jerking, okay, gait, and the leg stiff that we have, okay, on the toes of dogs. So it can be a spastic paraplegia or a spinal cord tumor, or it can be multiple sclerosis. So during our assessment or during our interview, okay, we are going to ask, of course, the patient about limited function or discomfort in specific parts of the body. So we might ask these questions to our patient. Does your jaw ever get stiff or hurt when you jaw? Okay, do you get a stiff neck? Okay, we ask about problem talking about ribs ache or feel tender. We're talking about joint stiffs in the morning. So those are possible questions that, okay, talking about as muscle cramps of the patient. Okay, how far are you able to walk as part of our assessment? Are you able to take care of your home, get in and out of the bathtub, as well as climb stairs? So those are possible questions, okay, that you need to ask during your interview to determine if your patient experience limited function or discomfort to a specific parts of the body. And in our physical examinations, just a glimpse, okay, on the physical examination, so we examine the active and the passive range of motion of all joints of the patient. And we need to note basically the degree of improvement and without assistance. So for the shoulders, so the patient should be able to lift both arms straight above the head, okay, with arms straight at the size that we have. So that's how we are going to check in the 180 degrees and the hands supine and 110 degrees with the hands prone that we have. For the neck, we ask the patient and able to turn the head, okay, laterally and to flex and extend the head approximately 30 degrees in all directions. And another one for the elbow, okay, the patient should be able to open the arms fully and flex the joint enough to allow the hand to touch the, okay, to touch the shoulder. And then for the wrist, the patient should be able to bend the wrist 80 degrees in the plantar direction and 70 degrees in a dorsal direction. For the finger, the patient should be able to bend the distal joint of the fingers approximately 45 degrees that we have. Okay, for the hip while lying down, so the patient should, okay, the patient should be able to flex the knee, okay, while lying down, talking about the hip, okay, so the patient should be able to abduct and adduct the leg 45 degrees that we have. Okay, so for the knee while lying on the stomach, the patient should be able to flex the knee approximately 100 degrees. So the knee, okay, while lying on the stomach, the patient should be able to flex the knee approximately 100 degrees natin. So the key concept, okay, that you are going to remember, that the absence of a typical size of fracture does not guarantee that a bone is not broken. Therefore, close nursing observation is essential whenever a bone has been subjected to trauma. So fractures heal more slowly in older adults, as mentioned earlier, and the risk of complication is greater. So what are the possible complications with regards for patients who experience fracture? It can lead to possible pneumonia, okay, thrombus formation. You can have also, okay, you have also your, okay, so you have in here, possible complication. It can be your pneumonia, okay. It can be thrombus formation. Okay, you have also pressure ulcer, okay, the pressure ulcers, the renal calculi, okay, fecal impaction, and of course your contractures rather. Okay, these are among the complications that a nurse, okay, should give attention to prevent this to occur once the patient has fractured. So, activity within, talking about pneumonia, thrombus formation, the pressure ulcers natin can be prevented by turning the patients every 2 hours, egg mattress that will be used, of course, frequent assessment of your patients, especially for signs of the developing pressure ulcer. Okay, so those are possible nursing interventions that can help prevent this to happen. So activity within the limits determined by the physician should be promoted, including the deep breathing exercise, you have the coughing exercise, your isometric and the range of motion exercise, and of course talking about the turning or the frequent turning and position changes of your patient. And then the fluid should be encouraged also. The fluid should be encouraged, and the characteristic of urine output must be noted. So good nutrition will facilitate healing process. Increase resistance to infection and decrease the likelihood of other complications. So joint exercise and the proper positioning can prevent contractures. Correct body alignment can be maintained with the use of footboards, through chanter rolls and the sandbags that we have. So keeping the skin dry and clean, prevent pressure, stimulating circulation through the massage and frequent turning, the patient may reduce the risk of decobity or your decubitus ulcers. Sheepskin and water beds that we have and alternating pressure mattresses are beneficial, but they are not substitute for good skin care and the frequent position changes natin. So the patient should be mobilized as early as possible, because the patient may fear using the fractured limb and avoid doing so. Explain and reassure that that is usually required to help the patient understand the healed limb is safe to use. Progress and small steps may be easier for the patient to tolerate physically and psychologically. And then the first attempt during ambulation may be to stand at the bedside. So parang yung pedia that we are trying to help, talking about practicing the developmental milestone. So papatayuin, papalakarin at the bedside, and then next to walk to a nearby chair, and next to walk to the bathroom. So that's parang yung sabi natin on the usual growth and development as the child start or practicing the milestone of walking natin. Especially talking about this patient may with the help of course of 2 people natin to assist this patient during ambulation. Once the patient experience weakness and dizziness also. So please take note again that in order to prevent also orthostatic hypotension, we need to emphasize to our patient the gradual change of the position. And the principles of nursing management for specific types of fractures are, of course, usually available. So you have a lot of possible references that you are going to enhance your learning, talking about your nursing or specific responsibility to the specific fractures that you are going to take care as a nurse. Okay, so to continue, on the second musculoskeletal condition that we are going to discuss, it's your osteoarthritis. So what is this osteoarthritis? Osteoarthritis is a progressive deterioration and abrasion of the joint surfaces that we have. Abrasion of a joint cartilage with the formation of new bone at the joint surfaces that we have. This problem occurs increasingly with advanced age and affects most person over age 55 to some extent. It occurs in women more than in men, and it's the leading cause of physical disability in older adults natin. Unlike rheumatoid arthritis, osteoarthritis does not cause inflammation, deformity, and crippling, a fact that is reassuring to the affected individual who fears the severe disability often seen in persons with rheumatoid arthritis. For many years, it was believed that the wear and tear of the joints as an individual ages were responsible for the development of osteoarthritis. but the greater insights into the pathophysiology of the condition have afforded a new understanding. That the reason for this, the reason it's brought about by disequilibrium. So what are the factors that causes or predispose the patient to experience this disequilibrium? So you have the excessive use of the joint, the use of the joints, excessive use of the joints. Another possible, the joints. Okay, another possible factor, you have also the trauma. Okay, you can have trauma. Obesity, it's another possible factor. You have low vitamin D and C. Okay, and you can have also genetic factors. So these are predisposing factors for patient to experience disequilibrium. Disequilibrium on the destructive as well as on the synthetic elements that we have. On the synthetic elements natin. Disequilibrium on the destructive. Okay, front lang yung sulat. Hindi nyo rin mabasa. Okay, talking about the destructive as well as the synthetic elements that we have. And because of that disequilibrium between the destructive and the synthetic elements, it causes basically lack of hemostasis. Kasi walang may disequilibrium, so walang hemostasis, leading to the joint to change because the cartilage was not maintained. Kasi kailangan para ma-maintain yung cartilage, kailangan yung hemostasis natin. Okay, so patients with acromegaly also has high incidence of osteoarthritis. And osteoarthritis affects several joints rather than a single one. Okay, the weight-bearing joints are most affected, and the most common site being the knees, the hips, and the vertebrae, as well as the fingers. Again, the osteoarthritis is the leading cause of physical disability in older people. So, again, I want you to recall what are the possible effects if the patient is unable to maintain this physical ability. So, ang dami-daming natin na pag-usapan na possible complications or risk if the patient experience physical inability or disability. So, systemic symptoms do not accompany osteoarthritis. Okay, you can have also this crepitation on the joint motion. Okay, may be noted, and the distal joints may develop bony nodules that we have. So the patient may notice that the joints are more uncomfortable during the damp weather, and although isometric and mild exercise are beneficial. But the state note that excessive exercise also will cause more pain and degeneration. So, to address the concern or the discomfort or the pain experienced by your patient, commonly, the doctor will prescribe the use of our analgesic. And commonly used analgesic is your acetaminophen. So you have acetaminophen. It's one of the most commonly used drug, and this is the first drug of choice because of its safe over the non-steroidal anti-inflammatory drugs. Because a certain individual has different response talking about the use of analgesic, the nurses should assess the effectiveness of various analgesic for the patient. Okay? Aside from the use of analgesic, other interventions that can be given in order to relieve the pain experienced by your client, it can be, provide rest to our patient, heat and cold application to our patient, the aquatherapy, and of course the gentle massage will help. Gentle massage can help relieve joint aches experienced by your client. And acupuncture also has been shown to bring about a short-term relief for this patient. And immobility, such as the use of splint, the braces and canes provide support and rest to the joints of your patient. The nurse also should emphasize the importance of, as a nurse, we need to emphasize the importance of, okay, maintaining a proper body alignment. Body alignment, okay, maintain this body alignment. And another one, we are going to use a good body mechanics that we have. Body mechanics and body alignment, and that is our role when educating the patient. Maintain that body alignment and the body mechanics that we have. And of course, we need to emphasize talking about the inclusion with regards to the diet of your patient, that cold water fish and other food. High in, ano yung mga cold water fish that we have, okay, those are high in essential fatty acids natin. And according to the research, okay, it contains, okay, anti-inflammatory effects and should be abundant in the diet for patients with osteoarthritis. And aside from the essential fatty acids that has, okay, anti-inflammatory effects, we are going to advise the patient also to have these vitamins, okay, such as vitamin A, vitamin B, vitamin B6, and vitamin E natin. So, aside from the vitamins, okay, we need to emphasize also to increase your zinc, the mineral content of your patient or intake, such as the zinc, your selenium, your niacinamide, okay, your calcium as well as your magnesium. Your calcium and of course your magnesium. Okay, these are among the nutritional supplements that could prove or improve in controlling the symptoms of brought about by osteoarthritis. Okay, so the over-the-counter supplements also, such as your, okay, the over-the-counter supplements such as your, okay, glucosamine, okay, your glucosamine, and of course your chondroitin, okay, chondroitin and your glucosamine, okay, have proved helpful for some people. But one important thing that we are going to consider is weight reduction. Weight reduction improves the obese patient status and should be encouraged. And it is beneficial if a homemaker service of other household assistants relieve the patient of strenuous activities that cause the joint to bear weight natin. So, we have some nursing diagnosis, okay, concerning, okay, osteoarthritis. So who can formulate? Of course, one of the highest priority talking about, okay, your nursing diagnosis for patient with osteoarthritis. It's your, tama yung nasa isip mo, talking about, okay, pain. So, chronic pain related to inflammation, stiffness, as well as your fluid accumulation. So, one, of course, is your chronic pain. Chronic pain, okay, related to, you have, okay, joint inflammation, and you have also joint inflammation, okay, you have stiffness, and fluid accumulation. So, one nursing diagnosis is chronic pain related to, okay, joint inflammation, stiffness, and fluid accumulation. So what's our goal with regards to this? So the patient basically express relief or control of pain or unrestricted by pain to engage in activities of daily living, free from adverse effect also of our analgesic. Another nursing action is to administer analgesic as ordered or instruct the patients in proper self-administration. We monitor the effectiveness as well as the tolerance and the side effects of the patient. As mentioned earlier, you can have also ask the patients to maintain a good body alignment as well as the posture. And we assess the impact of pain on the ability to fulfill activity of daily living of your patient. Okay, we instruct patients ways to minimize stress to joints and muscles that we have. Another nursing diagnosis that can be formulated aside from chronic pain, you can have also your, anong nasa isip aside from chronic pain? You have, tumpak. Tamang-tama naman nasa isip mo. We're talking about the impaired physical mobility related to pain and limited joint movement that we have. Impaired physical mobility. So you have impaired physical mobility. So you have impaired physical mobility. It can be related to pain and limited joint movement that we have. So your goal basically is to maintain or achieve functional position of joints and maintain or achieve optimal joint mobility. It's free from flexion as well as your contractures. Okay, so what are possible nursing action? Just to give you some of the possible nursing action in order to achieve our goal to address basically the impaired physical mobility of your patient. So we assess the patients in the range of joint motion on admission or during the visit of your client. And when we instruct or assist the patient in, still maintain the proper body alignment, the good posture, as well as correct use of joints that we have. Kaya kanina, we emphasize of course how important in our teaching, in the maintaining the body alignment as well as the good or the maintenance of the good posture that we have. We advise also the patients to avoid stressing joints, the scheduled analgesic administration. So yun yung mga common nursing intervention in order to achieve our goal in addressing this impaired physical mobility of your patient. We use basically also during the exacerbation of pain, we provide adequate rest for joints and assist the patient in positioning the joints in a functional alignment natin. So if other treatment fail to improve the condition or the person suffers severe functional limitation or pain, arthroplasty may be indicated. So once we're done with some of the interventions that we mentioned earlier and still the patient's conditions did not improve, that's the time that the patients will be submitted for surgical intervention. You have your arthroplasty. So I posted a video presentation from YouTube talking about the arthroplasty or joint replacement to restore the joint movement or motion of your patient, improve the function as well as reduce pain. So that's the purpose talking about this surgical intervention. So sabi nga natin, after those interventions performed and yet the condition of the patients did not improve, so that's the time the patients will be indicated for arthroplasty. So you have your surgical intervention, your arthroplasty. And this arthroplasty that we have, it's indicated in order to restore restore the joint motion, restore the joint motion. And another one, improve the function, and of course reduce the pain experienced by your patient. So that's the purpose why we need to submit the patient for a surgical intervention such as your arthroplasty. At one time, older people were not considered good candidates for arthroplasty. However, the thinking has changed and increasing number of people over the age of 65 are having joint replacement. Hip and knee joint replacement are those most common, although arthroplasty can be performed in any joint that we have. So I want you to watch the video for you to appreciate how arthroplasty done, and of course the discussion on the different nursing responsibility for patients who will undergo arthroplasty. So ability to cooperate and rehabilitations are those patients not advised to have this kind of intervention. And conditions such as peripheral vascular disease and diabetes mellitus, because it increases the risk of infection and interfere with the wound healing. Yung matanda na nga, delay na yung wound healing, plus meron pang diabetes mellitus yung client natin that decreases the healing process and predispose the patients to have a lot of infection. So hindi sila sinasama for or a good candidate for arthroplasty. So while assuring that pain is controlled adequately to support early rehabilitation, we must consider that high risk of adverse effect from analgesic can also hamper the rehabilitation. So it is our role as a nurse to closely monitor or observe our patient with regards to reactions on the surgical intervention. And this arthroplasty also is usually associated with anong possible complications for patients will undergo arthroplasty. Okay, you have your possible complication for this is your DVT or the deep vein thrombosis, and another possible complication for arthroplasty, post-arthroplasty that we have is your pulmonary embolism. Your pulmonary embolism. Your pulmonary embolism. Okay, for this is older patient. So in order to prevent this deep vein thrombosis, the patient should give prophylactically medications such as your warfarin. So to prevent this complication to happen, okay, the patient will receive warfarin. The patient will receive warfarin. Okay. So, patients and their caregivers need to be advised of precautions related to anticoagulant therapy. And the patients receive a specific instruction pertaining to their exercise, the weight bearing, as well as activity restriction. Nurses must see that patients and their caregivers understand instructions and adhere to the plan of care to ensure a successful outcome for the surgery. Successful outcome for the surgery. Okay, so that's all talking about your osteoarthritis. So if you want to enhance your learning process talking about osteoarthritis, I want you to watch the video that I was posted in your classroom. So let's proceed to another condition, a musculoskeletal condition, your rheumatoid arthritis. So what is this rheumatoid arthritis and how it differs with your osteoarthritis? Rheumatoid arthritis affects many persons, particularly those ages 20 to 40 years old. So it is a major cause of arthritic disability in later life as a result. Fortunately, the incidence decreases after the 65 years of age. Most older patients with this disease develop it in an earlier in life. Specifically, that deformities and disability associated with this disease primarily began during early adulthood and peak during middle age, and in old age, greater systemic involvement occurs, and this disease occurs more frequently in women than in persons with a family history of the problem that we have. In rheumatoid arthritis, what happened? The synovium becomes hypertrophied. The synovium of the patient, the synovium become hypertrophied. And edematous, with projection of your synovial tissue protruding into the joint cavity. So the affected joints are extremely painful, stiff, swollen, red, and warm to touch. Joint pain is present during rest and activity. The subcutaneous nodules over bony prominences and bursae may be present, as may deforming flexion contractures. Systemic symptoms include you have your fatigue. It can be body malaise. Patients will experience weakness, and we have weight loss, wasting, fever, and anemia. So we encourage the patients to rest and provide support to the affected limbs. Are good measures to relieve the discomfort experienced by your patient. Limb support should be such that pressure ulcer and contractures also are prevented. So splints are commonly made for the patient in an effort to prevent deformities natin. And we advise the patients basically to have this range of motion exercise are vital to maintain the musculoskeletal function. So the nurse may have to assist the patient with an active exercise. Physical and occupational therapists can provide assistive device to promote independence in self-care activities, and heat and the gentle massage as well as your analgesic can help control the pain. So patient with rheumatoid arthritis may be prescribed again with an anti-inflammatory agent such as disease-modifying anti-rheumatic drugs such as your methotrexate, your medications such as your corticosteroids. You have corticosteroids, Okay, and immunosuppressive drug. Suppressive drug that we have. Okay, so you have immunosuppressive drug. So the nurse should be familiar with mainly toxic effect of these drugs and detect them early if they occur. So if function becomes significantly impaired or pains severe, joint replacement surgery may be recommended on this patient. So some patients with rheumatic heart disease are sensitive to the nightshade foods or potatoes. Okay, so these are the foods. They are highly sensitive, especially the patients with rheumatic heart disease. Okay, talking about your eggplant, the tomatoes, and other solonites, and eliminating this from the diet could prove beneficial to the patient. Herbs that could improve symptoms that include the green tea, the ginger for their anti-inflammatory effects. Okay. However, there are limited research talking about the benefit as well as the risk while using this green tea and ginger and to address this rheumatoid arthritis that we have. So for patients with rheumatoid arthritis and their families need considerable education to be able to manage this condition. We educate the patients that include information about the disease, the treatment, the administration of medication, as well as identification of side effects and exercise regimens, as well as your assistive devices or the method to avoid and reduce pain, and on understanding of the need for a continued medical supervision. Accepting this chronic disease is not an easy task, as we all know, for either the patient or for the family. Finally, the patients may be a prime target for, salespeople offering a quick cure or a relief of arthritis, and should be advised to consult a nurse or physician before investing money on useless spots that we have. Okay, let's proceed to the next topic, which is your osteoporosis. What is this osteoporosis? Osteoporosis is the most prevalent metabolic disease of the bone. It primarily affects adults in middle to later life that we have, in some groups also being at a higher risk than others. Demineralization of the bone occurs, evidenced by a decrease in the mass and density of the skeleton of the patient. Any health problems associated with inadequate calcium intake, excessive calcium loss, or poor calcium absorption can cause osteoporosis that we have. So many of the following potential causes or problems commonly found among older persons that we have. So what are the risk factors for the development of your osteoporosis? One is the advanced age. Advanced age natin. For women, 65 years and older. You can have also ethnicity, calcium deficiency, vitamin D. So you have calcium and vitamin D deficiency that we have. You can have also estrogen deficiency. You have history of multiple pregnancy. Cigarette smoking, high alcohol consumptions, prolonged immobility. Even history of your osteoporosis. So those are the possible risk factors for the development of your osteoporosis. So what are the possible nursing diagnosis? Talking about this problem, it can be your inactivity or your immobility. So lack of muscle pull on the bone can lead to loss of minerals, especially calcium as well as your phosphorus. So the diseases such as your Cushing syndrome and excessive production of glucocorticosteroids by the adrenal gland is believed to inhibit the formation of the bone matrix natin. So this increases the metabolic activity of your hyperthyroidism, causes more rapid bone turnover and the faster rate of bone resorption to bone formation that causes osteoporosis. Excessive diverticulitis also can interfere with the absorption of sufficient amounts of calcium natin. Although the direct relationship is uncertain at this time, diabetes mellitus also can contribute to the development of osteoporosis. And the percentage of cases, of osteoporosis that result secondary to other diseases is relatively small. decreased production or loss of estrogen and androgens may be responsible also for insufficient bone calcium. Therefore, postmenopausal women, as mentioned earlier, are at risk or high risk to develop osteoporosis. So, with regards to the diet, as another possible factor that will contribute for the development of osteoporosis is insufficient amount of your calcium. Okay, vitamin D, the vitamin C, you have your protein and other nutrients in the diet. Okay, it can cause also osteoporosis. Insufficient. Okay, and excessive consumption of caffeine or alcohol decreases the body absorption or retention of your calcium. Laging umiinom. Okay, laging umiinom ng kape as well as your alcohol can lead to possible decreased body absorption and retention of calcium that can lead to possible osteoporosis that we have. And those clients who are taking medication also such as your heparin, okay, the furosemide that we have, okay, the thyroid supplements also, corticosteroids, antibiotics such as your tetracycline, and magnesium and aluminum based antacids can lead to possible osteoporosis because this maalox that we have, it will decreases also the absorption of calciums natin that can lead to possible osteoporosis natin. So, to what risk factors for osteoporosis are you subject that you want to, of course, how are you going to reduce that? So, with the factors that we mentioned earlier, okay, try to contemplate, saan ka ba doon? Okay, and how are you going to reduce the risk of having this osteoporosis? And osteoporosis also may cause kyphosis. Okay, you have your kyphosis and of course, reduction in height that we have. So, kabaliktaran ito sa lordosis and the pride of pregnancy. Okay, in here, you have your kyphosis. Okay, the person may experience spinal pain, okay, especially in the lumbar region of your patient. And the bones may tend to fracture more easily for patients with osteoporosis. So, patients often asymptomatic and unaware of the problem, and it is usually detected by radiography or by x-ray natin. Bone mass density can be measured through several different types of non-invasive techniques that we have, such as your DEXA. Yung DEXA, it's a dual energy x-ray absorptiometry that we have. And another one, it's your DPA, it's a dual photon absorptiometry. Dual photon absorptiometry. And then for the treatment, it depends on the underlying cause of the disease, and it may include, okay, calcium supplementation, vitamin D supplementation, it depends on the cause, and then selective estrogen receptor modulators or your SERMs. Okay, ano yung mga management natin? Just, okay, go back to the possible cause why your patient experienced osteoporosis. So if that's talking about, okay, decreased calcium intake or decreased retention or decreased absorption of your calcium, so we need to have this, okay, calcium supplementation. So one is calcium supplementation. So calcium supplements. You have also vitamin D supplements. Okay, vitamin D supplements that we have. The patient also may receive SERMs or your SERMs stands for the selective estrogen receptor modulators. And of course, you have also hormone therapy. So these are possible treatment, but it depends on the underlying cause experienced by your patient. A relative recent drug that has been found beneficial in improving or producing modest increase in bone mass is the synthetic form of your calcitonin. Okay, the synthetic form of your calcitonin. Okay, so a hormone produced in the thyroid that is powerful inhibitor of osteoclastic activity. The cells that continuously reabsorb bone that we have. A diet rich in protein and calcium is usually encouraged for patients with osteoporosis. Okay, braces may be used to provide support and reduce spasm experienced by your client. And a bed board is also beneficial and should be recommended. And we advise the patients to do some regular exercise that can aid in bone in retaining density natin. Okay? And the nurse must advise the patients to avoid heavy lifting, jumping, and other activities that could result in fracture. Kasi nga sabi natin, okay, this particular patients with osteoporosis are at risk to have fracture. So persons providing care for these patients must remember to be gentle when moving, when exercising, or lifting them because fractures can occur easily. Napaka-brittle ng bone ng patients with, okay, with this condition. So, compression fractures of the vertebrae are a potential complication of your osteoporosis. So, the ROM exercises and ambulations are important to maintain function and prevent greater damage to our patient. Again, okay, part of your nursing responsibility for patient with osteoporosis is to maintain, okay, you have to, the ROM, the range of motion exercises that we have, and of course, your ambulation. Okay, these are important, okay, advice that we need to give to our patients in order to maintain function and prevent greater damage to our patient. So the bodies of person with osteoporosis must be handled gently to avoid fractures again that I would like to emphasize. Okay. Next. Okay, so another musculoskeletal condition that we are going to discuss is your gout. Gout is a metabolic disorder in which excess uric acid accumulates in the blood. As a result, okay, there is uric acid crystals, okay, deposited in and around the joints of your patient that causes severe pain and tenderness of the joint and warm redness and swelling of the surrounding tissue. During an acute attack, the pain can be quite severe and then the person may not be able to bear weight or have a blanket or clothing rest on the affected joint. Attacks can last from weeks to months with long remissions between attacks possible. The treatment includes, okay, aims to reduce sodium urate through a low, okay, with regards to the diet of your patient, you have low purine diet. Okay, because we are trying to reduce sodium urate, okay, on your patient. So, we avoid, okay, bacon, the turkey, liver, the kidney, the brain, okay, yung mga lamang loob ng yung mga paborito ko. Okay, talking about the sardines, the mackerel, the salmon, and the legumes, and the administration of drugs that we have. Alcohol also should be avoided because it increases uric acid production and reduces uric acid excretion. So aside from low purine, okay, diet of your patient, we must encourage the patient also to avoid alcohol intake. Avoid alcohol intake because sabi nga natin, this alcohol causes, okay, causes reduction on uric acid excretion as well as increases uric acid production. Mabagal na pag-excrete ng uric acid, mabilis pa ang uric acid production. So, kailangang tanggalin yung alcohol for patients with gout. And another one, you have also, okay, colchicine, okay, you have your phenylbutazone, okay, phenylbutazone can be used to manage your acute gout that we have. Phenylbutazone, okay, this is used, this is medication used in order to manage acute attack of your gout. And then the long-term management could include, okay, colchicine, okay, so yung long-term natin, an acute attack is phenylbutazone, and then colchicine is usually given, okay, as part of the long-term management that we have. Colchicine is usually given as part of your long-term management, such as your allopurinol also, or indomethacin that we have. The gout attacks can be precipitated by your administration of your thiazide diuretics. It can be precipitated by the administration of drugs, and the thiazide diuretics that we have increases the uric acid level of the blood of your patient. Vitamin E, the folic acid, and they can be a useful dietary supplements for patients with gout. And herbs such as yucca, okay, not very common here in the Philippines, are a good diet supplements to our patients to reduce symptoms in some person. And nurse should monitor the pain and encourage a good fluid intake to prevent the formation of the renal stones of the patient. Formation of the renal stones. And then another condition aside from the gout is your podiatric condition. Your podiatric condition. What is this podiatric condition all about? What is this podiatric condition? Okay. So, podiatric condition, these are foot problems that cause some degree of discomfort or dysfunction, or so common among older adults that this area can be commanded a specialty of its own. Okay, you have your podogeriatrics. So, lifelong foot problems, changes in gait, diseases that affect the feet such as your gout, your diabetes, and peripheral vascular disease, and age-related loss of fat padding of the foot contribute to foot conditions. Okay, the older person's own shaving, the cutting, and the chemical treatments of podiatric condition can result in a serious complication. Therefore, we inform the patients, okay, to podiatricians for the treatment of foot conditions that they experience. And then the nurses should teach also older adults about proper foot care, okay, such as the keeping feet clean and dry, wearing safe and the proper fitting shoes that we have, and the importance of seeking professional podiatric care for problems encountered. Sasabihin na kasi, malayo sa bituka yan, hindi na tayo magpapa-hospital, magastos, but it's common talking about the, okay, socioeconomic concern of these elderly people. Nurses can offer foot massage because they can aid in stimulating circulation, reducing the edema, and promoting comfort of our patient. Okay, foot massage may be contraindicated in patients with peripheral vascular disease. Okay, peripheral vascular disease that we have. It is important to consult with a physician first when you do some foot massage for patients with peripheral vascular disease, because the impact of podiatric problems can on mobility and independence. These conditions need to be effectively identified and treated with some of the common conditions that we have. So, one possible, of course, is your calluses. Okay? So, these are caused by friction and irritation. So, yung mga kalyo natin on the feet that create layers of a thickened skin that we have. It reduces the fat padding of the foot, the dryness of the skin, and decrease toe functions natin. Okay? And poor fitting shoes contribute to callus formation. Yung masyado masikip pala, pinipili talaga, paghapon, wala na. Okay? So, they usually appear on the heel and the soles, and although not painful, can be unsightly. There is a risk also that people will attempt to shave or cut off calluses from their feet and risk injuring their skin, and massaging the feet with lotions and oils can aid in preventing calluses that we have. For another one, you have also your the hallux valgus natin. The abonion or bursa is a bony prominence over the first metatarsal head. These are medial deviation of the first metatarsal with abduction and with the great toe in relation to the metatarsal natin. Some bunions, some bunions are hereditary in nature. The increased width of the foot caused by the bunion can cause difficulty in finding properly fitting shoes natin. Shoe repair shops can stretch shoes to accommodate bunions natin, and custom-made shoes are also beneficial for your patient. And surgery may be indicated for some cases, for patients with bunions. Another one is your hammer toe. Okay? Hammer toe or digitiflexus. Hammer toe, other term is the digitiflexus. Okay? Hammer toe or the digitiflexus. Flexus that we have. So, hammer toe is an hyperextension at the metatarsophalangeal joint with flexion and often corn formation at the proximal interphalangeal joint that we have, the interphalangeal joint. The toe begins to resemble the shape of the hammers inside a piano. Thus, its name, okay, you have the hammer toe that we have. Although the joint itself is not painful, pressure to the area results in discomfort. Okay, the orthotics can provide symptomatic relief, but surgery is necessary for correction of this condition. Another one, aside from that, of course, common, you have the infections in the foot of your patient. Infections, okay, housing of the foot in shoes, particularly in ones made from synthetic materials, create a warm, moist environment that facilitates fungus and bacterial growth natin. So as the fungus forms under the nail and displaces it up, and sides of the nail are pushed into the skin and cause pain, antifungal preparations assist in eliminating the infection. But these infections are stubborn to treat. So, Tinea pedis, better known as the athlete's foot, okay, is a fungal infection of the foot that cause burning and itching sensation of the skin surface with peel, crack, and be red, often with vesical eruptions that we have. Okay, so let's proceed to the general nursing considerations for musculoskeletal conditions. Okay, so we have three part of the general nursing considerations. We will focus on managing the pain, okay, preventing injury, and we promote independence to our patient. So let's start on the managing pain experienced by your patient. Pain, okay, often accompanies musculoskeletal problems. Degenerative changes in the tendons as well as your arthritis are often responsible for pain, okay, or painful shoulders, your elbows, okay, your hands as well as your hips, okay, the knees and the spines. Cramps, especially during the night, are common in cause, okay, the feet as well as the hand and the hips of your client. Joint, okay, strain and damp weather more frequently cause musculoskeletal pain in the old than in the young. So pain relief is essential in promoting optimal, okay, physical, mental, and social functions natin. Because once you are in pain, kahit if you are not elderly, okay, basically there, okay, be concerns talking about your ability to function mentally, physically, as well as socially. Unrelieved pain can interfere with an older person's ability to engage in self-care, manage their households, and maintain social contact that we have. So to enrich the quality of life, every effort should be made to minimize or eliminate pain. Often, heat relieves muscle spasm, a warm bath at bedtime, and keeping the extremities warm with blankets and clothing can reduce spasms and cramps throughout the night and promote an interrupted sleep that we have. Because older adults are at high risk for burns, okay, care must be taken to avoid injury if heat applications or soaks are used. So the passive stretching of your patient, okay, especially on the extremities, can be helpful in controlling muscle cramps of your patient. And excessive exercise also and musculoskeletal stress should be avoided, as well as your situation known, okay, to cause pain. Ano yung mga possible, the heavy lifting that we have, especially during the damp weather natin. So these are the methods for reducing musculoskeletal pain. So letter A, okay, good body alignment. Letter B, we need to support of parts of the limb adjacent to the painful joint that we have when moving or lifting. And letter C, another possible is the use of a cane or a walker natin. Okay, so unrelieved pain can significantly affect an older person's independence and the quality of life. Therefore, diversional activities are useful in preventing the patient's preoccupation with pain. So, acupuncture, acupressure, okay, the chiropractic therapy are among the alternative therapies that may help some patients, okay, control pain. Guided imagery and your therapeutic touch may also prove helpful. And then the goal is to aid the patient in achieving the maximum level of activity with the least degree of pain. Another, nursing responsibility or nursing consideration is preventing injury. So safety precautions or considerations are essential for all older person because of the high incidence of accidents and musculoskeletal injuries, and the prolonged time required for healing. Prevention includes paying attention to the area where one is walking, climbing stairs, and curves slowly. Using both feet for support as much as possible, the using rails and canes for added balance, wearing properly fitting safe shoes for good support, and avoiding long trousseau and the nightgowns or robes that we have. The importance of the safe use of heat has already been mentioned. It is useful for patient to learn how to measure water temperature, the use of hot water bottles and heating pots safely. Patients with peripheral vascular disease must be warned that the local application of heat can cause circulatory demands that their body will be unable to meet. Other means of pain relief may be more beneficial to them. Warm baths can reduce muscle spasm and provide pain relief also. But they can also cause hypotensive episodes to our patient, leading to possible dizziness, fainting, or a serious injury. Carelessly turning the patient so that the legs hit the bed rail, dropping them into a chair during a transfer, restraining them in an unaligned position, roughly handling a limb, or attempting to use force to strengthen a contracture can lead to muscle strain and fractures. The gentle handling will prevent unnecessary musculoskeletal discomfort and injury. And the last nursing considerations in the musculoskeletal condition is promoting independence. Any loss of independence associated with the limitations imposed by musculoskeletal problem has a serious impact on physical, emotional, and social well-being. Therefore, the nurses must explore all avenues to help patients minimize limitation and strengthen capacities, thereby promoting the highest possible level of independence that we have. The possible level of independence. The use of canes and walkers and other assistive devices can often provide significant aid in compensating for handicaps and should be used when feasible. Physical and occupational therapies can be valuable resources in determining appropriate assistive devices for use with specific deficits. So these are, the figure, as you can see on the PowerPoint presentations, are the self-care devices that can help the client with musculoskeletal problems achieve the maximum independence possible. For letter A, you have the assistive feeding devices help the client to grasp and get the food on the utensils. And letter B, you have Richer, is a handy device for the client with mobility restriction. You have a raised toilet seat, makes it easier for a person who has trouble lowering him or herself to the toilet seat to safely use the toilet at home. So with that, I'd like to thank you for your active participation during our synchronous discussion, and of course your active listening. Hope you learned something for this discussion, and hope you are going to watch some of our videos, some of my videos talking about geriatric disorders. Thank you so much.